Hi everyone, this is Malia Kirby, one of the practitioners on staff here at Blue Poppy Enterprises and the Distance Learning Coordinator. And we're here today with Dr. Anzaldua, author of the Acupuncturist Guide to Medical Red Flags and Referrals, which I have with us right here. How are you today, Dr. Anzaldua?
I'm doing very well.
Good, I'm glad to hear that. First, I'd like to ask you a little bit about your background information. Where did you receive your education? How did you come into contact with Oriental medicine? And how has that changed your practice today?
Well, my initial education was in biology and physics, and I went on to get an MD at the University of Illinois College of Medicine. And then I did a 3-year residency in family medicine. And became board certified in family medicine, and then later I did another specialty in regenerative medicine as a specialty, and I'm board certified in that also. As far as my association with Oriental medicine, I would have to say that from the very beginning of my education, I was open-minded and wanted to look into any type of style of practice that could result in good healing effects. So I considered Oriental medicine very early in my career, actually, along with other types of medicine, Ayurveda and other types of medicines around the world, Native American medicine and a bunch of them. And my interest in Asian medicine was probably heightened by the fact that I was doing martial arts and introduced to the concept of chi and meridians and striking points and things like that. So that was something that was an early interest for me. So through the years, I've studied that. But then when I moved to California, I became a teacher. I became aware of the fact that actually it started when I had an acupuncturist patient and realized she was my patient. I realized that there was a kind of a hole in her understanding of breathing problems, and I thought I could help that out, and one thing led to another. I became a teacher and eventually became the head of Western medicine at one institution, and then I eventually became Dean of Integrative Medicine at another, and senior professor. I've taught in acupuncture TCM institutions for probably 15 years now. So that's how my interest began. During that time, I also, even though I don't have a formal degree in TCM, I did study with a number of masters, and I currently incorporate acupuncture techniques in my practice. As a matter of fact, I've developed a style which will soon come out publicly, which combines acupuncture with homeopathic remedies and other types of physical modalities. So I fully incorporate it. And I've always had clinics that, even before I did much of this kind of work, where I had acupuncturists work in conjunction with acupuncturists and clinical medicine clinics. And I currently have an acupuncturist on my staff also. So we do a pretty integrative type of practice. So I would say the roots are pretty deep.
Well, I'm glad to hear that. Now, why red flags? What inspired you to write this book for us?
Well, again, I think the initial impetus was like when I met that acupuncturist that I still remember very well. I was in the lounge getting ready to leave, and I have this in my books, open with it actually. And one of the students came in. They were concerned about one of the patients who had a sore arm and turned out to have a supracondylar fracture of the humerus, which is potentially you can lose a limb with that because it can compress the arteries that go into the hand. And that was a red flag, and I realized that like a lot of practitioners, including MDs, the student was very open and a very nice person and not prone to being suspicious, but it pays to have a certain amount of suspicion regarding certain conditions, because even though they don't arise very often, when red flag condition arises, you have to recognize it. And I realized that there was a big role there. And I also recognize that red flags is something that is not, this is a subject matter that's not taught well in medical schools as well as acupuncture schools. Red flags or certain types of conditions that appear sometimes out of the blue in normal course of practice can often be surprising, and they are within a bunch of different systems. I mean, if you're looking at the cardiovascular systems, there's a few red flags there, there's a few in respiratory. So it's hard, you know, I hadn't seen a text that really concentrated on the red flags themselves without, you know, across the board and put them all in one kind of textbook. So I thought that would be useful. And actually it's turned out to be more useful than I realized. And even though my current practice is aimed toward vitality and vitality medicine, I think you're really not free to practice vitality medicine or wellness medicine until you can actually recognize the red flags and clear them out and deal with them one way or another for them, or whatever you need to do. Make a decision so that you can treat the majority of the less serious conditions that are actually present.
Yes, I completely agree. Now, what do you feel that the book's strengths are in relation to Oriental medical practitioners?
Well, what I've tried to do is write it in, you know, I believe that I read once I read something about technical language once that stuck with me for a long time, and the ability of people to understand the technical language. And the book that I read made the point that most people are more intelligent than we give them credit for, but their ability to handle the terminology or the jargon is less than we expect. And I try to keep that in mind because so I don't put a lot of technical language in the book. I will put that in parentheses because I think it's useful to know and it's interesting, but I think the clinical situation can be described in patient's terms and non-technical terms, and I try to do that throughout my book, even though there's a lot of technical language there also. But anything that I say technically, I also say in a more user-friendly way. So I think that's good, and I think I've organized it in clinical scenarios, which are very important and useful, and that is the way that modern clinical medicine is best taught, is in a problem-oriented format. So that's what I've tried to do it.
Okay. What Western techniques do you feel that acupuncturists and Chinese herbalists should be incorporating into our practices, and why do you feel that we should be?
Well, probably the best way to answer that question is to tell you about an instance that happened. I think I mentioned this to you before in prior conversation, but recently I had my acupuncturist has never had an emergency situation in the clinic, my clinic, until approximately 2 weeks ago, or about a month ago, when one of our patients, she was a pregnant woman who could not lay down on a table, was getting acupuncture, and she fell off the table. She passed out, fell off the table, hit her head on the floor. So, and it was quite a fall. I mean, the total distance must have, I don't know, with her sitting there, probably 5 feet. You know, she struck her head from a 5-foot distance. So that's the kind of thing that can come up, and some pulse-taking abilities, not for necessarily characteristics of the pulse, but if there's an arrhythmia there, abnormal heartbeats, or blood pressure techniques would have been quite reassuring to the patient and very good for my charting. And we could have ascertained whether or not, you know, she had an arrhythmia, seizure, etc. So, or low blood pressure, something like that. So I think, you know, rather than getting fancy, I think there are some basic techniques that all practitioners should know. And those include how to take a good blood pressure. So, and you know, I have to tell you that this is something, it has taken me 30 years to maybe 20 years to take a good blood pressure in every condition. You know, of people who are difficult to get a blood pressure on, people who tense up, people who don't like to give their arm, you know, people who are afraid, you know, there's all kinds of different people and patient types, and some require a slightly different technique of taking the blood pressure. But at the very least, to have an automatic blood pressure cuff there, and take blood pressures on patients is a good one. Another thing is looking at ears, doing a basic abdominal exam,
Yes.
those kind of things. To mention physical things, there are a lot of historical things. The book goes into great detail about what are the most historical facts. I think the strength of the book, get back to your prior question too, is that I focused on what are the most important facts that you can ascertain from the history, what are the most important signs. There are a lot of signs. If you go to any book and you look up any particular condition, like pneumothorax, let's say, there are a lot of signs and symptoms, but specifically there are a couple of them that are really important, like sharp respiratory chest pain, tachycardia, for instance. You know, so we need to look at the specific ones and really identify them quickly.
What advice would you give to our field to further improve our practices and to improve upon our relationships not only between ourselves but into Western practices, allopathic medicine, and so on? How can we, how to phrase it exactly, what would your suggestions be to further improve upon our relationships to really incorporate ourselves and make sure that we have a truly integrative medicine?
Okay, I think that's a good question. That's the thrust of my book, why I wrote it. Actually, it's not just to present a bunch of facts, but there's a process to clinical work, healing, and there's a process to the communication, that style or communication that occurs between different acupuncture practitioners when they refer to each other, or acupuncturists who refer to medical doctors who refer to acupuncturists, family practitioners who refer to specialists who refer to family practitioners. It's an art of communication, and unfortunately not taught very well in schools. It's assumed, I think, that you're going to pick it up on your own, but in fact, you can have a lot of trial and error there. But there are some, and you can make a lot of mistakes along the way, but I address that in the book. There's a psychology of referral as well as a methodology. You know, I think seeing yourself as a collegial person, I think that, you know, part of that is confidence. But part of the majority of it is recognizing that we're all on the same team, that the patient's
Exactly.
good is number one, so that kind of trumps any kind of fears or suspicions we may have of each other, which generally get in the way. I think we need to acknowledge we have fears, and fears of adequacy, our own adequacy or competence, fears of their competence. Are they going to hurt the patient? Are they going to think we hurt the patient? Or, you know, all those things are natural anxieties and fears that arise, and we feel them too. I mean, even the most experienced practitioner has some of those fears. Not like they don't exist. It's that we have them under control, and the main thing is to again remember that we're all in the same team, whether the other person understands that or not. Just like when you're with a patient, the family, you're on the same team with the family. The family's on the same team with you, and healing occurs because of a web of interactions that are present. So I think to separate ourselves out and separate ourselves, you know, that's a medical doctor and an acupuncturist, even though separations do occur legally and there's some factual basis to them, we need to remember what brings us together, and I think that's extremely important. And people need to remind themselves of that. And then having the methodology of the referral is extremely important, because when you refer smoothly and competently, you know, that builds upon itself. That builds confidence. You're going to get a referral back a lot of times. You know, you're not going to lose patients if you do it right. You're going to get, it's a practice builder. As I put in my book, I probably can't emphasize that enough. Most people who really are very successful recognize that, and they have eventually come to that on their own. But, you know, overcoming those fears, taking the initial steps, believing in yourself, believing in your part in the healthcare process, that you're part of the team. You know, I tell my students sometimes, unless you're going to go to Tahiti and practice in a hut, you're going to be part of the modern healthcare team. And I have no problem if somebody wants to go to Tahiti and practice in a hut. Sometimes I feel like I'd like to do that. But I'm not going to do that here. You know, I'm going to be part of a team, and you know, so we need to, being that that's the case, we need to maximize our communication process in the team.
I think that's very sage advice. Thank you. Do you have any further comments that you'd like to add? Anything that we haven't already discussed?
Well, that's a lot of them. I'm very positive about this. I think we all have a lot to learn, and there's nothing to be ashamed of in that. We all have a tremendous amount to learn. We all have a tremendous amount to offer. So I think staying in balance, on balance about that, understanding that, and then making use of information like this, I think is very important. So that the bottom line is, you might think I would say, is that the patient benefits from our adequacy of communication and knowledge base. So that's really what it's all about, doing the best job we can for our patients.
Exactly. Exactly. I couldn't agree more. Well, thank you for joining us today, Dr. Anzaldua, and thank you to anyone who is watching our video that we'll be broadcasting. And remember, Dr. Anzaldua's book is An Acupuncturist Guide to Medical Red Flags and Referrals, which we have published here at Blue Poppy Enterprises. You can pick that up for yourself at our website, www.bluepoppy.com, or you can give us a call at our toll-free number, 1-800-487-9296, and we would be happy to send a copy out to you. Also, bear in mind, we will be having continuing education opportunities with Dr. Anzaldua very, very soon. So be sure to keep your eyes peeled and check our continuing education tab on our website regularly. We'll be sure to announce that when his classes are ready and available for sale. Thanks so much. Have a great day, Dr. Anzaldua.
Okay. See you in the seminar sometime. It's going to be fun.
That's right. We'll see you soon. Bye-bye.